Hi guys, and welcome back to EverlastCyber. We'll be going through the part 11 video in our NACC PSW questions and answers series. So let's start right off with question 1. During a two-person transfer with a mechanical lift, the PSW's job is to A. Control the lift alone, B. Position the sling and communicate, C. Hold the resident tightly, D. Lock the sling straps. During a two-person transfer, only one PSW operates the lifts. Both of them cannot operate the lift at the same time. So, like the question says, the PSW's job is not to control the lift alone. In option B, during that two-person transfer with the mechanical lifts, both PSWs should have clearly defined roles. So where one of the PSW operates and controls the lift, the second PSW's responsibility would be to position and check the sling properly, ensure that the straps are correctly attached, and also communicate with the resident and the other PSW. This provides reassurance and monitors the resident's comfort and safety. In option C, it's not advised to hold the resident tightly during a mechanical lift because it is unsafe and can cause injury. And this also interferes with the lift mechanism, so it's not advised to hold the resident tightly. In option D, straps do not lock. They are secured or attached, not locked, and both PSWs should ensure proper attachment. So looking at the options we have, the best answer here is option B, position the sling and communicate. So like I earlier stated, the two caregivers should have their responsibilities stated where one of the PSW is operating and controlling the lift. The other PSW will position and check the sling, ensure that the straps are correctly attached, and also communicate with the resident and the other PSW. Question 2. When a resident starts sliding out of a wheelchair, the PSW should A. Call for assistance, B. Pull them up alone, C. Remove the cushion, D. Push their knees forward. If a resident begins sliding out of a wheelchair, it is considered a safety risk and a potential partial fall. However, the PSW must not attempt to pull them up alone because this can cause injury to the resident. So, if the resident has very thin skin, it can lead to skin tears. If the resident also has osteoporosis, it can lead to fractures and dislocations. It can equally lead to injury to the PSW, such as giving them a back strain, and there is an increased chance of a full fall. In this scenario, the safest action is to stay with the residents, support them only enough to prevent a fall, and call for assistance from another staff member in order to help reposition the residents safely. Like I earlier mentioned, pulling them up alone is unsafe and it is against the safe lifting or mobility guidelines. Removing the cushion will make the sliding worse and also increases the injury risk. Pushing their knees forward can cause the resident to fall forward or out of the chair. So you must never push a resident's knees in order to reposition them alone. Our answer here is option A. The PSW should call for assistance immediately. Question 3. A lack of interest, emotional well-being, enthusiasm, or concern which appears as indifferent is called A. Apathy, B. Sympathy, C. Aphasia, D. Empathy. Apathy refers to a lack of interest, motivation, enthusiasm, or emotional response. So the person may appear emotionally flat or indifferent. Sympathy is a feeling of pity or sorrow for someone else's situation. It is usually an emotional response and not a lack of interest. Apraxia is a neurological condition where a person has difficulty carrying out purposeful movements, even though their muscles and senses are normal. However, this does not relate to emotions. In option D, empathy is the ability to understand and share someone else's feelings. This is, however, the opposite of indifference. So, out of these options, the correct one is option A. Apathy is a lack of interest, emotional well being, enthusiasm, or concern. Question 4. A resident with osteoporosis is most at risk for A. Skin tears, B. Falls and fractures, C. Stroke, D. Pneumonia. Skin tears is common in older adults, but it is not specifically linked to osteoporosis. Residents with osteoporosis have weak, brittle bones, and this makes them highly vulnerable to fractures, even from minor falls or simple movements. This can lead to fractures because their bones are weak and brittle. So, this is why fall prevention is a major safety priority for these residents. A stroke is not related to weakened bones, as well as pneumonia. Pneumonia is a respiratory condition and it is unrelated to bone density. So our answer here is option B. Residents with osteoporosis um, have a higher vulnerability for falls and fractures, which are caused by their weak, brittle bones. Question 5. When using a gait belt, A. Ensure it is snug but fits 2 fingers. B. Place it over bare skin. C. Hold the resident's arms. D. Pull on the belt to lift. When using a gait belt, safety guidelines requires that it should be snug so that it would not slip, but it should also be loose enough to fit 2 fingers underneath the belt. This ensures control without causing the residents discomfort or restricted breathing. In option B, placing it over the bare skin is not advisable. It should not be placed on bare skin. Always apply it over clothing in order to prevent skin injury and discomfort. In option C, you should never pull or hold the resident's arms during ambulation because this can cause loss of balance or shoulder injuries. A gait belt is for guiding and supporting, not for lifting. Lifting with a belt can cause injury to both the resident and the PSW. So, out of those options, when using a gait belt, ensure it is snug but fits 2 fingers, and that is option A. Question 6. Restraints are used only A. For staff convenience, B. When a family asks, C. With a physician's order, D. During meals. Restraint should never be used for staff convenience because this is illegal, unsafe, and it violates the resident's rights. It should also not be used when a family asks. A family request is not enough. Restraints are not used for convenience or because a family member requests it. They should only be used as a last resort when all other alternatives have failed, and they should be used with a physician's written order. This ensures the resident's rights, dignity, and safety are protected. Restraints are also not to be used just because it is mealtime. Only medically necessary situations with an order permits the use of restraints. So out of the options, the answer is option C. They should only be used with a physician's order. Question 7. A resident with expressive aphasia becomes frustrated when trying to speak. What should the PSW do first? A. Finish their sentences. B. Ask yes or no questions. C. Speak loudly to them. D. Tell them to relax. Finishing the residents' sentences can increase their frustration and make them feel disrespected or rushed. A resident with expressive aphasia knows what they want to say. It's just that they have difficulty forming or expressing those words, so they become frustrated. The PSW should simplify communications in order to reduce their stress, and they can do this by asking yes or no questions. This allows the resident to respond easily without needing to form a full speech, thereby helping them feel understood and supported. In option C, speaking loudly to them is not the answer because aphasia is not a hearing problem. In option D, telling them to relax sounds dismissive and it may even increase their frustration rather than help the situation. So, the best action to take is option B, ask yes or no questions. Question 8. A diabetic resident is sweating, shaky, and confused. What is the most likely cause or issue? A. Stroke. B. Hyperglycemia. C. Hypoglycemia. D. Heart attack. Stroke symptoms usually include one-sided weakness, slurred speech, and facial droop. However, trembling and sweating is not a symptom of stroke. Hyperglycemia is like high blood sugar levels in the body, and it causes dry mouth, increased urination, and fatigue. However, shaking or sweating is not a symptom of hyperglycemia. A diabetic resident who is sweating, shaky, and confused is showing classic signs of low blood sugar, which is also known as hypoglycemia. It happens when the blood glucose drops too low, and this is often due to skipped meals, too much insulin, or increased activity. So, the immediate action is critical, and that is by providing fast acting sugar such as glucose tablets or juice. Remember, in this situation, you also have to notify a nurse. In option D, a heart attack signs includes chest pain, shortness of breath, and sometimes sweating. But confusion and shakiness are usually not signs of a heart attack or symptoms per se. So, out of these options, the correct answer is option C. With the scenario we have, it's possible that the resident is suffering from hypoglycemia, which is low blood sugar. Question 9. A resident on fluid retention asks for another glass of water. What should the PSW do? A. Give it secretly. B. Explain the restriction and offer mouth care. C. Say no and walk away. D. Remove all water from the room. Residents on fluid restrictions need to limit their intake for medical reasons such as kidney disease or heart failure. So, in option A, giving water secretly or giving any kind of fluid secretly is unsafe and it violates the care plans and physicians' orders. The PSW should politely explain why they can't have more fluids, and then they can offer alternatives to relieve thirst, such as mouth rinses or oral care. ice chips, or even sponge swabs. This approach helps to maintain the resident's safety, dignity, and comfort. Saying no and walking away is dismissive, and it also does not address the resident's discomfort or even provide alternatives. In option D, removing all water from the room is extreme and unnecessary. Residents still need supervised access to fluids. So, the best action to take in this scenario is option B, explain the restriction and offer mouth care to the residents. Question 10. When using a mechanical lift, what must be done before lifting? A. Lock the lift wheels. B. Ask another PSW to hold the resident. C. Ask the resident to stand. D. Raise the bed height. Before using a mechanical lift, safety is the top priority. So, locking the lift wheels ensures that the lift does not move during the transfer. This goes on to prevent falls or injuries to both the residents and the staff. In option B, the second PSW assists with positioning and communication, but not holding the residents in the air. In option C, mechanical lifts are used for residents who cannot bear their weight, so standing is not required. And in option D, the bed height is adjusted for the sling placement and comfort, not as a required first step before lifting. So our answer here is option A, lock the lift wheels. Some other safety steps include ensuring that the sling is properly positioned, checking the straps for secure attachments, and communicating with the residents. Question 11. A resident refuses their morning bath and says, "I'm too tired today." What should the PSW do first? A. Give the bath quickly. B. Tell the nurse the resident is non-compliant. C. Offer an alternative time and respect their choice. D. Document refusal without speaking to the residents. Residents have the right to refuse care, including bathing. So, giving the bath quickly in option A forces care upon the resident, and this violates their rights and can cause distress or aggression. In option B, labeling a resident as non-compliant is inappropriate. Communication should focus on care planning and safety, not on judgment. So, in this situation, the PSW should acknowledge the resident's feelings, offer an alternative time or modified care plan. So, you can offer a partial bath or a face or hands wipe down. You should also document the refusal and notify the nurse if it is required. This approach respects the resident's autonomy while ensuring hygiene needs are met safely. In option D, the PSW must interact with the resident first, offering alternatives and explaining options before going ahead to document. So the best approach is option C. Offer an alternative time and respect their choice. Question 12. The best way to check the temperature of bath water is A. Ask the residents. B. Use your elbow or wrist. C. Feel with the hand wearing gloves. D. Measure with a bath thermometer only. In option A, the resident may not be able to accurately assess the temperature, especially if they have sensory impairments. The elbow or inner wrist is the most sensitive area to detect water temperature, and this would help to prevent discomfort for the residents or even burns. The ideal bath water temperature for adults is usually around 37 to 40 degrees centigrade or 98 to 104 degrees Fahrenheit. In option C, filling the water with your hands wearing gloves is not advisable because gloves reduces sensitivity, so you may not be able to detect if the water is too hot or cold. Thermometers are helpful but may not account for hot spots. It is advisable to always double check by touch. So we have our answer in option B, using your elbow or wrist to check the temperature of the bath water. Question 13. A resident on bed rest complains of heel pain. What should the PSW do? A. Massage the heel firmly. B. Apply lotion. C. Float the heels off the bed. D. Ignore the pain. A resident on bed rest is at risk for pressure injuries, especially on the heels. Massaging the heel firmly can damage their fragile skin or even the underlying tissue, and this is um, increasing the risk of pressure injuries. Applying lotion keeps the skin moisturized, but it does not relieve pressure, which is the resident's main concern. Floating the heels means placing a pillow or rolled towel under the calves so that the heels do not touch the bed. This will relieve the pressure that you're feeling and also prevents further skin breakdown. Ignoring the pain is unsafe and it could lead to pressure ulcers or injury. So the best action the PSW can take is option C, floating the resident's heels off the bed. Question 14. The first step before ambulation is to A. Check footwear. B. Give medication. C. Remove the walker. D. Encourage running. Before ambulating a resident, the PSW must ensure safety by making sure that the resident is putting on the proper footwear that has non-slip soles and provides support. This will help to prevent trips, falls, and slips during ambulation. While giving medication may be part of care, it is not the first step for safe ambulation. Walkers are mobility aids, so removing them would make ambulation unsafe. Running is also unsafe for residents, especially those with mobility challenges. So the first step before ambulation is option A, check footwear. Question 15. A resident with congestive heart failure has increased swelling in the legs. What should the PSW do? A. Increase their salts. B. Lay them flat. C. Encourage more fluids. D. Report the change. Increasing the resident's salt increases the fluid retention and can worsen their situation. Laying them flat can also increase fluid backflow and cause breathing difficulty. Increased swelling or edema in the legs of a resident with congestive heart failure can indicate fluid retention or worsening heart function. In this case, the PSW should not be encouraging more fluids. Instead, they should observe and document the swelling and report it immediately to the nurse or healthcare provider. Then they should follow any care plan instructions for positioning or monitoring. So our answer here is option D, reports the change. Prompt reporting helps to prevent complications like shortness of breath or worsening of the congestive heart failure. Question 16. When a resident falls, the PSW must not A. Assess for breathing. B. Call the nurse. C. Move the resident to the bed. D. Stay with the resident. Remember, the question says the PSW must not do one of the following when a resident falls. Um, Let's look at the options. In option A, assessing for breathing ensures that the resident's immediate safety is guaranteed, and it could also identify life-threatening issues. You should definitely call the nurse or health care provider for further assessment and care. In these options, moving the resident to the bed is something that should never be done because there could be some serious injuries like fractures or spinal injuries. The correct action to take is stay with the resident and keep calm, assess their breathing and responsiveness, call the nurse immediately, and then wait for trained personnel to safely move the resident. So, out of these options, the one that the PSW should not be doing is moving the resident to the bed. Question 17. Which finding should be reported immediately? A. New onset of slurred speech. B. Mild redness on the heel. C. Residents ate only half their breakfast. D. Complaints of boredom. Slurred speech can be a sign of a stroke or other serious neurological events. This should be reported immediately to the nurse or healthcare provider for urgent assessment and treatment. Looking at the other options, mild redness on the heel should be monitored and documented. However, it is not an emergency. A resident eating only half their breakfasts is also not an emergency. Complaints of boredom is also not a medical emergency. So, out of these options, the one that should be reported immediately is option A, the new onset of slurred speech. Question 18. When applying anti-embolism stockings, the PSW must A. Apply them when the resident is standing, B. Roll them down halfway, C. Apply them before the resident gets out of bed, D. Apply lotion first. When applying anti-embolism stockings, it will be difficult to apply them while the resident is standing. This is also unsafe because it increases the risk of falls and it could provide an improper fit. Stockings must be fully rolled on smoothly. Rolling down reduces their effectiveness and may even cause pressure points. Anti-embolism stockings are used to prevent blood clots in residents who are immobile or on bed rest, so they should be applied while the resident is lying down before they get out of bed. This is to ensure it is a proper fit and to prevent injury. The proper application of these stockings improves their circulation and reduces the risk of deep vein thrombosis. In option D, lotion can make the stockings slip and not fit properly, thereby reducing their effectiveness. So, this is not a correct option. Out of this option, the correct one is option C. The stockings must be applied before the resident gets out of bed in order to ensure a proper fit and to prevent injury. Question 19. When caring for a resident with MRSA in isolation, the PSW must use A. Gloves only, B. Gloves and gown, C. Mask only, D. No PPE needed. MRSA or methicillin-resistant Staphylococcus aureus is a contact spread infection. When a resident is in isolation, the PSW must use contact precautions, and this could include gloves and a gown. Gloves to prevent hand contamination, and the gown to protect their clothing and skin from contact with the bacteria. Depending on the situation, a mask may even be needed if there is a risk of splashes, but gloves and gowns are required for the normal routine care. Gloves alone is insufficient. The mask alone is also insufficient. Question 20. A PSW smells alcohol on a coworker's breath during shifts. What is the most appropriate action? A. Ignore it. B. Cover for them. C. Report the charge nurse immediately. D. Confront them aggressively. Ignoring this is unsafe and it could put residents at risk. Covering for them also violates workplace rules and the residents safely. If a PSW notices a coworker appearing impaired or smelling of alcohol, it is a serious safety concern. The correct action is to report immediately to the charge nurse or supervisor and avoid trying to cover or handle it personally. Ensuring the residents safely is the top priority, so the best action is to report immediately. Confronting them aggressively could escalate conflict, and this is not professional. So the best action is option C. Report to the charge nurse immediately. Question 21. A resident's skin tears easily. What is the best approach when repositioning? A. Drag them using the sheets. B. Lift using a draw sheet. C. Pull their arm to roll them. D. Leave them in one position. Dragging the residents causes friction and shearing, and this increases the risk of skin tears. Residents with fragile skin are at high risk for skin tears, so in order to safely reposition them, it is advisable to use a draw sheet to lift or move the residents rather than dragging them across the bed. Using a draw sheet will reduce the tension, the friction, and shearing forces, thereby protecting their delicate skin. Pulling on their limbs can injure their joints or skin, and leaving them in one position can lead to pressure injuries, which is equally unsafe. So, the best approach when repositioning this kind of residents is to use a draw sheet to lift them. Question 22. A resident suddenly becomes confused after being alert earlier. This may indicate A. Normal aging, B. Dementia, C. Delirium, D. Personality change. Aging does not cause sudden confusion. Usually, the changes are gradual. Dementia develops slowly over months or years. It doesn't just happen suddenly. Delirium is a sudden change in mental status and it is often reversible. It can occur over hours or days, and some common signs include sudden agitation or lethargy, confusion or disorientation, and fluctuating alertness. This can be brought on by infections, dehydration, medication, or medical condition. In this situation, immediate reporting is essential. Personality changes are also gradual and they are not typically having acute confusion as one of the symptoms. So, based on this option, the correct answer is option C, delirium. Question 23. A resident is on oxygen at 2 liters per minute. The PSW should A. Remove oxygen when showering. B. Adjust the oxygen level if the resident is short of breath. C. Replace tubing under blankets tightly. D. Check for kinks in tubing and report concerns. When a resident is on oxygen, the PSW's role is safety and monitoring. They have no business adjusting the flow rates. Proper care of this kind of residents includes checking the tubing for kinks or obstruction in order to ensure oxygen flows properly, and reports any issues such as disconnection, skin irritation, or shortness of breath to the nurse immediately. The PSW must never adjust the oxygen levels or replace their tubing or even remove the oxygen when showering. The oxygen should remain on if it is required when the resident is showering. All the PSW has to do is follow the facility protocol and never remove it without nurse guidance. So the answer here is option D. The PSW's job is just to check for kinks in tubing and report any concerns. Question 24. The safest way to prevent falls during transfer is to A. Hold the resident under the arms. B. Use proper footwear and assistive devices. C. Move quickly. D. Let them grab your neck. Holding the resident under your arms can cause injury to the resident's shoulders or ribs. Preventing falls during transfers usually requires planning, safety, and proper equipment. So, first, you can ensure that the resident is wearing non slip footwear. You can use walkers, gait belts, or mechanical lifts as needed. And also maintain proper body mechanics and communicate clearly with the resident. This approach will reduce the risk of injury for both the resident and the PSW. Letting the resident grab your neck is extremely unsafe and it can cause injury to both the resident and PSW. So, the safest way to prevent falls during a transfer is option B. Use proper footwear and assistive devices. Question 25. A resident who faints should be A. Laid flat with legs elevated, B. Raised to sitting, C. Given water immediately, D. Shaken awake. When a resident faints or experiences syncope, the goal is to restore blood flow to the brain and ensure safety. The correct actions to take in this situation is to lay the resident flat on their back, elevate the legs slightly to improve blood flow to the brain, and check for responsiveness and breathing, then call the nurse immediately. Sitting upright can worsen fainting and even cause injury from another fall. Giving water is only appropriate when the resident is fully awake and alert. The first priority is safety and circulation. You should not be shaking a resident awake because it is unsafe and unnecessary and can even cause further injuries. So, in this situation, the best action is to lay the resident flat with their legs elevated in order to improve blood flow to the brain. This brings us to the end of the part 11 video. Don't forget to like, comment, and share, and also hit the subscribe button so that you'll be informed when the last video on this series will be uploaded. Thanks for watching, and I'll